Today we're going to talk about a protocol that's pretty scary to a lot of people. It's the Peri-Mortem C-Section. So peri-mortem, you have the prefix peri, meaning around, and mortem, meaning time of death. So around the time of death, C-section. So why do we need this protocol? So let's go back to 1997, and two paramedics in New Jersey faced criminal charges, ultimately, over surgery in emergency, and we'll go into a little more. This was from the New York Times, September 27, 1997. So, full story. North Bergen, New Jersey, two paramedics were called to a home for a 37-year-old pregnant female in cardiac arrest, unknown downtime. They still don't know how long she was down. Paramedics arrived and unsuccessfully attempted to resuscitate the woman. They contacted medical control, who advised them to do a field C-section. Medical control walked them through it. It was a success. Baby survived, 100% neurologically intact. Paramedics lost their license for life and faced criminal charges. They were ultimately acquitted. But you can imagine the stress that placed on them and their families. So, let's talk about our protocol parameters now that we know why we put that protocol in place. It's protection for us in the 1 in a billion chance we ever found ourselves in the position we would have to do that. So, we're not going to do it with only 2 people. We have to have the personnel there with at least 4 people, ideally many more. Why? Because we're going to be doing resuscitation on mom and the baby. This is a must. The mother must be in cardiac arrest the whole time. You cannot have ROSC at any time during the event. You must attempt aggressive resuscitation on the mother, including high-quality CPR, IO access, and epinephrine. And it is a last-ditch effort to not only save the baby, but to save the mother as well. And we'll talk about that a little later. So, the protocol. Indications: gestation of 24 weeks or greater. And the reason for that is because 24 weeks is considered the age of viability. There must be a maternal cardiac arrest. No ROSC at minute 4 despite aggressive ACLS. So, you get in there, mom's in cardiac arrest, CPR in progress, get an IO in, get your epinephrine on board. Contraindications: less than 24-week gestation or ROSC before minute 4. So, the procedure, and I'll show you a graphic in a minute. Make a vertical incision from the xiphoid to the pubis using a scalpel, preferably a 10-blade. So you are making a large incision. Cut through all subcutaneous tissue to get to the peritoneal wall. Use your fingers to bluntly dissect the peritoneal wall and cut through the peritoneum vertically, ideally if you have scissors, or use the scalpel to initiate the opening inferiorly. Deliver the uterus, then cut the lower half of the uterus vertically, make sure it's vertical, to avoid the placenta, and then use scissors to extend the incision upwards until you reach the baby. Deliver the baby, and remember, the neonate will likely need resuscitation, so you need to have people right there. Clamp and cut the cord, squeeze the uterus, grasp the base firmly near the base. Place packing and towels in the opened uterus and abdomen as available to prevent bleeding. That's what you're trying to prevent. Hand the baby off to another qualified healthcare provider for resuscitation. And continue maternal resuscitation. Remember, Even though you are providing the C-section, you are the maternal resuscitator. So this is a graphic. You're making the vertical incision. So they have the retractors. Your retractors are going to be your hands. You will be delivering the uterus, so pulling the uterus out in order to deliver the baby. But this is the vertical incision and then delivering the baby. So, some good news. 62.5%, 25 out of 40 of field Peri-Mortem C-sections ever performed that have been reported have survived with 100% neurological intact status. So maternal resuscitation also improves due to the reduction of pressure on the inferior vena cava. So that's the other thing that happens when you pull the baby out. So for best chance for mother and child, the baby must be delivered by minute 5. But remember, the mother must still be in cardiac arrest. So you cannot get ROSC and then perform the C-section. Now, if the mother goes back into cardiac arrest and you do reach that minute 4, then you perform the C-section. The hardest decision is the decision to cut.